So we're going to talk about the HEBS project, which is the hospital event-based surveillance that was developed in Niger, specifically in the region of Maradi. So this was an initiative from their government, the Ministry of Health, to have a response on all the epidemic diseases that they have in their country, to be able to act quickly before it spread out. So they contact us in order to help them to better assist this kind of diseases. On this project, the objective was, as I mentioned, so to implement in health facilities some tool to help healthcare worker to be the primary reporting source such during a patient consultation. So, as I mentioned, to detect and report case of epidemic diseases like meningitis, malaise, cholera, as soon as possible in the community. So, and to have a coordination and support the response at the local, national level, depending on their role. And result to that, it will disseminate, they will validate if the information that was reported was true or false. So to do a better analysis on this disease in order to have an appropriate response to that. So, and with that, they will have a global and formal rapid view of the disease. Now we're going to talk about how, any questions so far before we move to the next. Do not hesitate to raise your hand or to stop me if you have some question on this. So now we will talk about, if there is no question, I will move to the hierarchy and the user for you to have a better idea. So there is multiple level. So we have the national level, which is the DSRE, the national and the regional level. So their role, it's really to report the signal information to high level, at the higher levels, and to provide the test result. So, but everything comes from the bottom. So maybe I should start with the bottom. You can see at the bottom, there is the focal point in the community. Just to let you know, the focal point in the community, it's usually the CHW, the community health worker, that are going to see the patient everywhere in order to know what is their status in health. And but for that part, we did not develop anything as a request from the partner. There is nothing developed at this level. The community health worker, what happened when he go to a patient and he detects something, so usually he call the coordinate, the responsible on the health center in order to fill the investigation or to report the case. So it's my call. And it's at the health center level that they use our application in order to enter the information that was reported by the community health worker, or even at the health center, a patient can come to the hospital and have some signs that need to be reported. So this is where they fill out the information. And then this information is reported at the district level. And depending on the case, it can be reported at the regional level and the national level. So, and all those have access to the application. As I mentioned, so the health center focal point or even the community health worker call and says there is a case. So he will register the signals. He will log into the application and register the signal, and then he needed to do an investigation. After register the signal, he need to do an investigation. The investigation report, it's just to fill out more detail about the case that was reported, to take maybe some samples if there is some analysis to be done, to take some samples and send it to the regional or the national hospital in order to be tested. So as soon as he do the investigation report, automatically there is a task that is sent to the district level to let them know that, to notify them that there is a report of signal. And they acknowledge this report of signal. And then if there was a result, sample that was sent to at the district level in order to do some analysis. So afterwards, when he receives the analysis, and he will use our application in order to report what are the results of this analysis. And then automatically it will be the focal point will be notified at the health center, and so on. And then if let's say, for example, this kind of a disease, they don't have the material, so this is why at the health center he send it also at the regional level or the national level. It will be the same thing. So he will receive a notification automatically to let them know that there is a case, and they will receive the sample to analyze soon. So as soon as they have the sample and the result, so he will log on to the application and report it, report the result, so that it can be sent to the lower level. So it's exactly the same process until the national level. As you can see, after that, we have the result notification. And based on the result, internally, they decide, okay, there is some action that needed to be done at the national level or at the regional level or at the district level, based on that. So now I'm do a demo of what we just discussed. Since it was developed in Niger, so just to let you know, it is in French. We don't have the English version because it's for the MOH, the Ministry of Health of Niger. So, and the default language, it's French, but I will explain everything. So I will connect, as I mentioned, it's only the health center level. Starting from the health center level, this is where we can connect to, we can connect to the application. So it's CHT, HE for health center, and user one. I always make this error. It's the underscore. Yeah. So when he log into the application to the CHT, so on the task he have all of the tasks that he need to do, and the reports and the contact. Where his health center here, the health center, it's at the Borja, and you can see all of the activity he did. So the task that you see here, I will come back to it later. This is investigation. So this means he has to do 2 investigations that are pending. So he did not do it, but I'm going to show you for the first time. So he received a call, there is a case, so he has to click notification, alert notification, and they ask him what kind of case you would like to report. There is milices, meningitis, cholera, or everything or something else. So let's say we're gonna say milices. So he will select it, and the question, he will fill out the form. Was it done today? Yes. Where the who did the notification at the CSI, the community health or other. So CSI, it's the health center. By who? By the community health worker, by no, not the community, the focal point, the community health worker, or someone from the hospital. I will say the community health. And where it was detected. It was detected at the house of the patient, or it was at the health center or somewhere else. So he will just choose. And when was it? I can select today, for example. And what is the district that it was detected? I will select Maradi, which is the region, and he say what are the health center. You have the list of health center of that country, that district. So I will select Bocha next, and this is where we ask him, do you want to do the investigation? If he say no, he can do it later. And this is why you see on my task, I have two investigations that I need to be done, because I did not do the investigation. Let's say he has many calls and he doesn't have the time to do it. So he can just stop right here and do the investigation later. But here we're going to do the investigation. So I will click yes, I want to do the investigation. So they will ask what is the name of the person that is having this issue, this case. So I will say John. And how old he is, let's say 5 years, and it is in month, the text, and I can put his contact number of the parent, and here usually it's the profession, the occupation. So, but for a child, it's not, but we can put the one from the parents, and again, the district. And before I click, okay, I will show it to you. So the same thing. And what are the village, exactly where it is located. So I don't have some village in head, so I'm gonna put just John village, but we can specify exactly the location with the GPS coordinate. You can specify it automatically and it will detect the position. But for now, I'm just gonna leave it like that. Okay, click next, and they want to know the classification of this epidemic case. So is it a case suspect, confirm, or there is a probability? So I will select suspect, and what are the signs? So he gonna select some signs that based on the report that he received, or when he went to see the patient, all the information, he gonna put some signs. I'm just gonna select two. And here it is when this is it started. So I have to specify the date. I can put today, or it started yesterday. And if it is started, what is the treatment that was given to the patient? I will say none. And what are you gonna do? Are you gonna hospitalize them, send him to the hospital, or just putting him on observation to see how the disease will evolve? So I'm gonna say hospitalization. And at this state, what is the evolution of the disease, the status of the disease, if I can say it like that? So is it in treatment, disease, or you don't know? I will say I don't know. I will just say I don't know, because I don't know. I don't have the information. And I will just click next, and then he will ask what are the vaccine that the patient receive. So you will select if he receives some vaccine. I will say no. Maybe he receives some, but it's just for the future. They are trying to have all the info. Okay. So so I'm gonna fill everything. No. And yeah. The last part, it's the contact case. Is there any other people that have also this disease? I will say no and submit. And here it's the sample. So if he did some he needed to do some analysis, I will say yes, he need to do some analysis. When it was done, at what time, and what type of analysis. It is blood. This is, I don't know, there is many type of analysis. You can do blood, you can do, so I'm just gonna select the blood one. And is it sent to the lab, how can I say it, labo, where we do, I don't know how to say it in English, but it's where we analyze the blood to detect something. So I will say yes. What kind of how it was done on a tube, and did you do some TDR? I'm gonna say yes. What was the result? Positive. And would you like to send this to the district level? I will say yes. When are you planning to send it today? Would you like to send it at the regional level? I will say yes. When are you planning to send it today? Would you like to send it at the hospital, but the national level? I will say yes. And this is the reference laboratoire where for specific cases, you can send it there. I will say yes. And here we go. So you have the summary of everything, and then you click submit. And it's really important to take this number, because this is the identification of the alert. We will need it later. Okay, so as soon as I did this, I submit. So for this case, it is done. Now, I will log out quickly. I will connect as the district level. Are all the tasks. He receives some notification for all of the investigation that he did. And this is the validation of the alert. For example, when the health center sent him some information and he needed to validate. So I'm just gonna take the one that we did, and it's not that one. I can know it by the number. It was 89. No, it's not that one. So it might be, yeah, it is this one. So he say, okay, I saw it. Okay, I know that there is a case. So he will just click submit. and that's it. This task will disappear. So he is waiting for this number in order to do some analysis. Let's say he received the sample and everything. So what he will do, he will come back here and select and mention that he will like to do his action. I have the result, I did it, so I'm gonna report it. So here, he's asking me what is the ID. So I'm gonna copy the same ID. And he will ask when it was done. I will say today, what are the aspects of the sample. So this is based on the result. So I'm not a doctor, so but I'm gonna select some stuff. And was it positive or negative? Let's say positive. What kind of test? I don't know the result. And there is a last question. Let's say that he detected something and he's not sure and he doesn't have everything to analyze. So we're gonna ask him if he would like to send those results. So I will say yes and submit. That's it. So now he submitted the result. If I come back to the health center, so he will receive this result. If I go to the upper level, he will also have the same thing that we did, so a notification alert, and then when he do the analysis, he have to report the result. So I'm just gonna do a last login. We're gonna go back to the health center. The synchronization. Yes, so here I can see that here it's the information of the result that the upper level sent him. So he have the information in order to know what's happened, and that's it. So yeah, so that's it for the demo. I know that we did only one level, but it's exactly the same process until the other level, depending on the case. So this project has really a good impact on the community and even at the national and the regional level. Because of that, the Ministry of Health of Niger is able to have a quick response on any diseases, epidemic diseases that they have in the country. So here you will see the link of, I invite you to consult it. You will see the link of their feedback on that. And for your information, this was possible because during COVID, we as Medic developed for them an application, they call it Alert COVID, to detect the COVID cases. So to be able to respond quickly and to treat it. And due to that, it was really, really successful. They contact us again to do this project, Alert Niger. So I invite you to check the link later.
We have Michael from Brink. I know you have been doing also a lot of work on surveillance. Do you have a minute just to share maybe any update or any question that you might have related to surveillance?
So I've noticed that the facility-based event surveillance has a lot more two-way engagement than what we'd originally conceived. From our end, it was largely data collection by the community health volunteer, and then with a tool to analyze the data and help them make decisions really quick. And at the time we were designing it, it was was geared around detecting outbreaks for COVID-19, and then later on trying to pivot to any other condition that might require, or any other priority condition that needs surveillance. So what I noticed largely from here is The additional planning tools built into this tool, as well as the two-way engagement between the data collector and the supervisor. All in all, it looks pretty impressive, so good job.